Public health units have provided farmers with safety guidelines for worker housing. Your employer should follow the guidelines and give you safety information and instructions as well. We do not want to confuse any information that the health units or your employer have given you. However, we want to draw your attention to some important health and safety considerations. During this pandemic, washrooms are a space we have to pay particular attention to in terms of health and safety, especially when we are sharing a washroom with others. The risk for transmission of this virus in washrooms is based on the fact that washrooms have a lot of high-touch surfaces. Washrooms are also a space where we may spread a lot of our droplets onto surfaces and objects. For example, if a person spits or blows their nose. In washrooms, we may also run the risk of coming in contact with a person's fecal matter that can carry the virus if the person is sick. Some important safety practices, particularly when you are sharing a washroom, include cleaning surfaces and objects regularly, many times a day, or even after each use if you want to be extra careful. Try to avoid touching the toilet with your hand, and if you do so, wash your hands right away. Wash the toilet regularly, but be careful when doing so. Make sure not to touch your face and wash your hands. When cleaning the toilet, try to keep at a distance. For example, spray the toilet with a disinfectant spray at a distance before getting closer. Open windows and ventilate the washroom before cleaning it. Wash your hands before and after washroom use. Keep the number of people sharing the washroom as low as possible and keep sharing among the same small group of people. Try to wait 15 minutes between users of the washroom and ventilate the washroom between uses as well. Store your belongings in a safe place outside of the washroom to reduce the chances that they can become contaminated. Do not share washroom objects such as towels and wash them regularly. Carefully dispose of washroom garbages like tissues frequently and wash your hands right away. Talk to your coworkers who you are sharing a washroom with about safety ideas and concerns to make sure you are on the same page. Share concerns or safety ideas with your supervisor and employer as well. Sharing a kitchen can also create risk for the transmission of this virus, as there are a lot of frequently touched objects and surfaces in the kitchen. If you are sharing a kitchen, clean surfaces, dishes, cutlery, pans, and other objects immediately after using them. Also clean objects like doorknobs, handles of fridges or other appliances, the tap, light switches, and anywhere else that people touch. The idea is to reduce the transmission of your droplets onto these objects or surfaces, or disinfecting them right away if droplets are transmitted. Although usually it is a good idea, during this pandemic, avoid sharing things including food like salt, pepper, sauces, coffee, tea, milk. By sharing, various people may be touching these objects and food and therefore risk transmission of the virus. You should take out the garbage so it is not left in the kitchen for long. Wash your hands after taking out the garbage. Organize the kitchen to have as much space between people as possible, and schedule cooking times so that there's only a few people in the kitchen at the same time. When the weather allows, prepare, cook, barbecue, and eat outside in the open air. Again, outside and being in open air reduces the chance of transmission if someone was sick and their small droplets were circulating in the air around them. If it is not possible to be outside, ventilate the kitchen as much as possible, open windows and doors. Talk about kitchen safety concerns and ideas with coworkers you are sharing a kitchen with, as well as with your supervisor and employer. It is important to also recognize the risk for the transmission of this virus in shared bedrooms. The risk here is sharing space with someone in close quarters for a long duration of time, including the hours of sleep overnight. If you are sharing a bedroom, set up beds at a distance greater than 2 meters apart. There is a risk of using both levels of bunk beds as the exhaled air can travel, so it is better to just use bottom bunks, and again, keep beds far from each other. Store your belongings in a safe place away from others to reduce chances of contamination and to allow for safe movement within the space and avoid chances of tripping. Ventilate the room, open doors and windows. Fans can help, but be careful of the direction fans are blowing. The idea is to let fresh air in and blow exhaled air out. You do not want to blow the exhaled air of someone in the direction of another person. Handle used clothes and bed sheets carefully. Try not to shake them out inside. Wash them frequently with warm or hot water. Consider not wearing your work shoes indoors to avoid the chances of bringing in anything from busy work floors into your housing. Talk about any bedroom safety ideas or concerns with coworkers you are sharing space with, as well as with your supervisor or employer. This video was produced by staff from the Occupational Health Clinics for Ontario Workers, or OCHO.